So first, let's get into the COVID-19 and discussion. And really, this becomes very relevant with telemedicine as well. So I think all of our practices have changed very markedly over the last few months. I know mine has. I'd like to just go around and hear from you guys. How do you feel like the emergence of COVID-19 has impacted your practice? And let's just start generally. What have you seen? What's different? Dr. Hamilton, you want to start?
Sure. It has really, as in many places, impacted almost every facet of how we do business. And I think a little bit depends on the prevalence in your particular area. I think we're moderately hit compared to some areas. From the time our patients walk in the door, our waiting rooms have chairs removed and our patients are physically distanced. They're limited on the number of companions they can have with them, their spouse or friends. Will often have to wait in the car. We're all masked, of course, which takes a little bit away from that dynamic that's so important with having difficult conversations with patients. So that's just the first 15 minutes of the encounter, and it kind of cascades on from there. I could go on, but I'm curious to hear how some of Tom's experiences or yours.
Yeah, Dr. Krivak, what do you think has been the biggest impact on your practice?
I agree with everything that Dr. Hamilton said. I think we're in a low impact to moderate impact area. I think Pittsburgh did a great job of being prepared. Our system had, in place, we were ahead of the game because of, I think, New York, where we, decreased patient visits. We switched over to telemedicine fairly quickly. I do think there are significant limitations for G1 Oncology to do telemedicine visits, because I think one of the most important parts of our exam is a pelvic exam. I personally don't think CT scans are great for that area at times, so I really do at times get nervous about a telemedicine visit when, women with cervical cancer probably should be getting a detailed pelvic exam. But I think the system did a great job of being prepared. No doubt about it, it has taken an inefficient medical system we work in and has made it probably more inefficient in that you have to call patients' families before and after surgery to try to keep them apprised of how their healthcare is going for their loved one in the hospital. And I've definitely seen a lot of fear from patients. I actually at times feel safer coming into work because of all the screening questions, being masked, than actually going into Whole Foods or going somewhere. And I think that I've tried to relay that onto their patients that, you're very safe here. We use a different part of the hospital for anybody that's COVID. We use different elevators. So to me, I think the system has done a great job and the city has done a great job with that. But there's no doubt about it. I feel very bad for patients having very intimate and complex conversations on speakerphone with numerous family members, trying to have discussions in the intensive care unit. Clinical practice, our volume was decreased probably by about 40%. I would say how we did it is we did our complex gynecology and kind of had those patients go and have them wait. We looked at our PPE and our ICU management to be able to debate how we could do our endometrial cancer patients as well as our ovarian cancer patients. So we didn't get too far behind with that. But I do think that probably over the next few months, we're going to see a delay in diagnosis and treatment for patients, unfortunately, with endometrial cancer, ovarian cancer, possibly cervical cancer as well. So I am concerned about what we're going to see over these next few months.
You definitely bring up a great point of delay in diagnosis. I think that patients aren't necessarily going into their, primary care providers, their gynecologists. They're not, maybe they're deferring evaluation of symptoms of concern. And I think we are going to see an increase as things loosen up. Here in Houston and in Harris County, Texas itself hasn't had a huge number of cases, although we haven't done a huge number of tests. So it's hard to know really what our actual caseload is. But in Harris County, they did really significant social distancing and stay at home, work from home practices early on. And I think it helped really flatten our curve. And so we were down significantly as far as our patient volume, but now we're starting to ramp back up cautiously. And I think we're doing a lot of the same things that you guys just mentioned, everybody wearing masks, PPE. We have no visitors allowed still, not for surgery or for clinic visits. And the majority, I would say the bulk of my clinic is telemedicine now. We are starting to see some new patients and consults in person for the patients, like you mentioned, that really need, an inpatient or an in-person exam.